Guys, and welcome back to another medification video. Today we're going to be going over episode 4, clinical trials. So this video could be of interest to anyone who's going to a university which has strength in its research, or anyone who's interested in research, or anyone not even just doing medicine or applying to do medicine, but pharmaceuticals, pharmacology, pharmacy, or any sort of variation of biology or chemistry even. Or if you're interested in any of those kind of branches of science, this video is of interest to you. So if you don't know if your university is one that's strong in research, generally most of the unis are interested in research, but the really strong ones will be the BMAT University. That'll be Oxford, Cambridge, Imperial, UCL, and any others that I've missed out. I don't actually know if there's any more BMAT universities.
Uh-oh, retard alert! Retard alert, class!
But yeah, so it is important to be able to understand research and its importance as well when you're applying to these universities. And the only person who doesn't need to know this is Shreya Sharma, because you don't get elected head of medical society for no reason, unless the vote's rigged. But that's not the case. Definitely not. Before we go any further, guys, just peep that background. That's peng. Don't even lie. So what are clinical trials? Clinical trials are medical research studies to show whether different treatments are safe and how well they work. Some trials involve healthy members of the public, and others patients who are offered to take part in the trial during their care or treatment. So a clinical trial can be done for 4 main reasons for the NHS. The 4 reasons would be to prevent disease and to reduce the number of people becoming ill. The second reason would be to treat illness and improve the survival rates of people, or to increase the number of people who are completely cured. The third reason would be to improve the quality of living for people who have certain illnesses or ailments. And the fourth one would be able to improve the way that they can diagnose disease or health problems. So trials cover a wide array of different types of research. Trials can be used to test new medicine or vaccines, but they can also be used to look at new combinations of existing medicines as well. They can also be used to test whether giving a treatment in a different way will make it more effective or reduce side effects. So some trials are designed to come up with ways to prevent a disease from reoccurring or even happening the first time. Another important thing to remember is that clinical trials aren't just about medicine or vaccines or vitamins. They can also be about lifestyle. Some of these can also be psychological as well. So for example, whether weight affects anger. Concern from the general public about clinical trials would be regarding the safety of clinical trials. So generally there are a large number of people who partake in thousands of different clinical trials each year. So each trial is specifically designed to minimise the risk on the participants, and they are monitored carefully and throughout the entire process, so their safety is the #1 concern. However, in March 2006, there was an issue with a clinical trial which went south, like Shreya's hairline. So in that clinical trial, 6 people got seriously ill, and it was a catastrophe. However, it's important to remember that these kind of things don't happen frequently. That was sort of a one-off, and it's extremely rare. So for anyone who wants to read up about that, can check out the link in the description. We'll try and find an article about that if you guys are interested in that, because that could be a topic you could talk about in your interviews if that's something that's interested to you, or an article that you could bring up. Just, it doesn't have to be relevant to clinical research. So another thing that concerns the public when it comes to clinical trials is who is funding them. Because generally, if the NHS is funding them, the general public would have an idea that it's as safe as it can be. However, there is a negative stereotype towards pharmaceutical companies who generally fund these kind of clinical trials. So I know there's generally been a negative stereotype around pharmaceutical companies providing finance for the clinical trials, and generally it's not always been reliable from pharmaceutical companies, because they do like to adjust the trials, sort of fix the results, like the MedSup vote, and they sometimes haven't had the best interests of people at heart. But it's important to remember that pharmaceutical companies have, the best expertise about this kind of stuff, and they've also got the resources necessary to develop and manufacture the drugs and medicine that people require in the future if the trial is successful and the data actually shows something significant. The government and medical research charities can also fund trials to study. Generally these will be to study surgery or physical and psychological therapy, and it could be about complementary treatments as well. So overall, it doesn't really matter where the finance comes from. The NHS or whoever requires data just needs to know that it's reliable. Now, we're going to just quickly go over the validity of clinical trials. There are various things that the trial needs to be able to be, or qualify as, to be considered trustworthy. So you need to have a large enough sample size. You also need to have a way to reduce natural error from testing it. So for example, placebos and stuff can help give you more accurate data, because sometimes patients aren't always that honest. Another way that it can be made more valid or accurate, trustworthy, could be by making sure that it's completely finished and done over a sufficient amount of time. Because you don't want to rush a trial and do it as quickly as you can for the sake of doing it. It has to be done properly, and doing that means taking your time. It's important to know that the data is valid if it can correspond to stuff in the real world. So if it looks like it's realistic and you can say, oh, this leads to this, or this can cause this, or is more likely to cause this, and the data seems very reasonable, then it seems to be more trustworthy. But if it's like bananas causes people to lose limbs and stuff, it's probably not going to be accurate, is it? Even if the data does show that, it's probably not corresponding to what's actually happened. So as we mentioned before with the finance, it has to be a reliable source of data and a reliable source of funding. So you don't just trust some medical website online. It's probably best to trust professionals, or particularly the NHS themselves, because they'll provide the most accurate data. And when it comes to funding, it's better off when it's coming from the NHS or, you know, pharmaceutical companies, or even just medical research charities. Those are the most reliable people for the funding. If it's privately done, then it can be a bit sketchy. Like the MedSoc Pope. Holy moly, this is so fun. Whoa. So one example of where a clinical trial has not been valid has been the 1998 Lancet case with Andrew Wakefield. So really briefly, what he did was, there was a bit of an issue with the MMR vaccine, so against measles, and he had patients who were coming into him who had issues with their children having autism, and they thought that the symptoms only started showing up after the MMR vaccine, so they thought that somehow they were linked. And then Andrew Wakefield, funded by the solicitors of the families who thought that the vaccine caused the autism in the first place, ended up creating a study to show that the MMR vaccine causes autism. Well, his great study, first of all, not financed by a reliable source at all, because it's financed by solicitors who want to make the NHS, or whoever was responsible for getting the children jabbed with the vaccine, they want to make them pay more money. So showing them as responsible, it's clearly not a reliable source of money. And the other main issue with it is the sample size. Now, a lot of the time you get a large enough sample size to show that there's actually a relationship in the data. However, Andrew Wakefield thought that 12 was enough. So his research is based on 12 patients, which is minute. So realistically, even if one patient had developed, autism from the vaccine, which isn't the case because they're not even related. So, but if had one, you say, oh, there's like a nearly 10% chance that, my child will get autism if he's vaccinated. But that's complete bullshit. If the percentage is 0.00001% and still somehow that small percentile caused that one person to get it, the data doesn't show that. Now, to this day, Andrew Wakefield has been thoroughly discredited, and he's actually lost his medical license. Unless I'm wrong, but I'm pretty sure he has. He's the type of idiot to say something stupid like this.
What are you guys doing?
I enjoy children.
And that's pretty stupid. Real quick, after the end, I should probably apologise to Shuria.